second. So the policy we chose to analyze for our project was the John H. Chafee Foster Care Independence Program. This analysis was done by Mary, Karla, and myself, Caprecia. So this quote here on the board, you can read it for yourself, but it just speaks to how many foster youth are aging out of care every single year. But when these youth age out, they're not receiving the support they need. So they're removed from a home and they're put into care to begin with, and then they're removed from the care, and their outcomes are worse than most other people. This includes educational outcomes, child rate, such as diseases, and also their likelihood to be hooked on drugs and get involved in other illegal activities. So the John H. Chafee program was created in 2000 and was created in response to so many people who were homeless being former foster youth. This program works to offer assistance for current and former foster youth aging out of the system. The purpose of the program is to help these youth reach self-sufficiency as they begin to navigate the world as adults. This program is super important because, as I mentioned earlier, when these youth age out of care, they're lacking the support. And when you lack support, you open up yourself to a lot of negative stereotypes and things that can come about, such as being a part of the jail system, ending up on drugs, being homeless, things of that sort. This is because youth who age out of care don't have that support that youth who are growing up into adulthood at home. The youth at home receive financial help and even advice from those in their lives. Youth from foster care age out and they're turned into adults in 2 seconds with no warning, no preparation. So the John H. Chafee program works to give them that preparation and give them the support. The program was influenced or impacted by Mr. Brace. Mr. Brace was a minister and director of the New York City Children's Aid Society, and in 1853, he began the free foster home movement. As he devised the plan, he worked in the South and West sectors of America to advocate for foster youth there as he looked for people who were willing to provide free homes for them. His daring and creative way of going about things really created the foundation for the foster care movement as it continues to exist today. So let's talk about the legislative history. First was the Adoption and Safe Families Act. This act, in our view, was pretty negative in the fact that it changed the age-out age for youth in foster care from 21 to 18. This required youth to be moved out of care at an even earlier age than they were before, without support. So this resulted in even more homeless people, more people on drugs, more children born out of wedlock, and also children who were susceptible to more diseases due to living on the street possibly or having parents who weren't properly educated. So then came the Foster Care Independence Act in 1999. This act created the Independent Living Program, which is better known as the John H. Chafee Foster Care Independence Program, which is actually what we're reviewing here today. This program was named after the late Senator Chafee, and this program was created to ease the transition from adulthood into adulthood for foster youth who had aged out of care. So overall, this policy does 4 things. First, it increases the support for young people moving from foster care into adulthood. Any youth who had not yet reached age 21 could receive these services if they had once lived in foster care. Second is that it provided extra funding to be allocated for adoptive incentive payments and establishing permanent homes for children aging out of care. So this provided extra money for those who were able to take care of children and extra incentives for them. Third is that while they were offering more money to take care of the kids, they did offer more requirements or set more requirements to ensure that these foster parents were properly prepared to take care of their children. And lastly, it allowed states to expand their Medicaid coverage up to age 21 for all youth who were in foster care up to age 18. This is really important because many youth, when they aged out of care formally, were left not only without any support, but no medical coverage, so they couldn't even go to the doctors when things went wrong. So how the program was implemented. In order to increase the likelihood that this program was properly implemented, the state offered grants and many other things to help people get these programs really growing and off the ground. So the way the program is funded, this program is very unique as it offers kind of a matching system here from the federal government. So whenever a state exceeds $45 million, the states were required to match the funding that they did in the session. States were allowed to use the Independent Living Initiative dollars to provide services for youth living in care up to age 21. These services that they offered could be used for basically anything to support the youth. It was educational needs, retreats, activities, weekend fun, things that provided them support with self-esteem, therapeutic needs, anything that basically just really put the best efforts and the best focus of these youth in mind. So how did they maintain effectiveness of this policy, or how was a policy review established? So a program assessment is required in order for the program to continue in a state, and the assessment must look over the measures of educational attainment, employment, avoidance of dependency, homelessness, non-marital childbirth, incarceration, and high-risk behaviors. These are looking at the demographics or the outcomes of the youth in the program. So on a low level, which is a local level, this assessment is done by the services, people who are rendering the services for the organizations. On a higher level, the Secretary of the Health and Human Services collects these reports from the states, and they review how the Chafee program is really operating in these states. But the review is not just left up to the Secretary of the Health and Human Services, and it's not up to just the organizations facilitating the resources. Former foster youth, current foster youth, and just advocates overall have a big say in how this review is done, and they are actually put into review and helping with the critiquing the program. So overall, Karla, Mary, and I believe that this policy is very good and effective. Our biggest concern is that this program isn't as available as it should be. Many youth don't have access to this program that should have access, so we look forward to seeing the expansion of this program as it is very beneficial. And throughout our paper, we use many references. We didn't want to leave those out, so those are here for you. But we thank you so much for this time, and we had a great semester. Thank you.